Oh no, the WHO makes another U-turn on the WHO bus. Now they're saying maybe lockdowns aren't such a good idea after all. Hey, do we have a second wave? It sure looks like it all over Europe and the United States, but maybe not. Not so quick. And by the way, more great news coming out on Ivermectin right now. So lots to look forward to in terms of treatments here. Come on, let's take a look at this. Hello everyone, Dr. Chris Martinson here. There I am down there in better lighting, I guess. That was a good studio day there. It's before I think I went on Cavuto's show there one time, early on in the pandemic, way back in February, I believe, or March, somewhere back there. Anyway, they didn't have me back on. Who knew? They weren't that interested in the truth and figuring out what's actually going on, but the world does catch up to logic eventually. That's always the good news here. So let's move right in. What's going on? Well, we got this. Say what? WHO official urges world leaders to stop using lockdowns as primary virus control method. No more lockdowns. The quote here is, "We in the World Health Organization do not advocate lockdowns as the primary means of control of this virus." This is Dr. David Nabarro. He told The Spectator's Andrew Neil, "The only time," he says, "we believe a lockdown is justified is to buy you time to reorganize, regroup, rebalance your resources, protect your health workers who are exhausted, but by and large, we'd rather not do it." And you can see another headline there. WHO warns against COVID-19 lockdowns due to economic damage. You know, that's not what they were saying as recently as just a few months ago. And so it's time, you know what it's time for? It's time to back up the WHO bus and make another WHO turn on the highway of information. This is just, this video is great. This is the WHO bus in action right here. I love this. So the WHO, if you remember, they came out originally way back in January. They said this isn't airborne. Then they said it's not, it is. And then they said it isn't. Then they said maybe we should wear masks. Then we shouldn't wear masks. Then maybe we should. Then lockdowns are necessary. And now lockdowns aren't necessary. People, you have to try hard to make a mess of things this big, like we're seeing right here. So, by the way, it was months ago that I was talking about how lockdowns are no longer necessary and how we have to balance all this out. So, by the way, I got a lot of flack for this one right here. This is talking about how lockdowns are now doing far more harm than good. This was on August 4th, 2020. What is it today? October 13th. So, this was a few months ago. And so here I was calculating things and saying, well, when you look at the amount of deaths that we're seeing now in SARS-CoV-2 and then COVID, the disease, and then when you calculate that against what we're probably seeing in terms of ruined lives, suicides, drinking and alcohol, domestic violence, there's all kinds of reasons people get really stressed by lockdowns, not least of which is if you're a business owner and your business is destroyed. That's a bad moment right there. If you are a worker who's out of work and you can't pay your bills, bad moments, right? So you have to balance these things out. You know, if only there'd been some way to articulate this in a framework that would have been useful a couple months ago, maybe all the way back in, February. This is what I was talking about way back. This is from an update I gave on February 24th, and it just said exactly the same thing that the WHO official just said, Dr. Nabarro just said. It's a balancing act. There's three things, obviously, you want to keep in balance. You need to keep people isolated and contained if you're trying to drop that R0 down so it's not spreading too quickly. Why? Because if you jump over to number 3 on this chart, you need to keep your infection rate below that which swamps your hospitals, either from capacity of beds, physical capacity, or mental, emotional capacity, physical capacity of your healthcare workers, whatever, right? But number 2 in the middle, that's the balancing act. You need to keep number 2 going because equally bad harm can come if you shut an economy down. I'm astonished that it's all the way out here in October and the WHO is finally wrapping their heads around this at this point in time. I can't make sense of it. It's really, just break out that WHO bus as many times as you want. These U-turns are exhausting. They're not helpful. And this was all logically figure-outable just so long ago, really long time ago. So that's my position on that, but things are getting a little weird. It is just a mess because think about how awkward that timing is. Now that we see things like, look at this, case counts exploding across Europe in particular. That's this chart on the left, daily new cases. You can see that there's 350,000 cases per day being reported now. Cases, geez, there I go. I keep calling it that. These aren't cases. These are detected SARS-CoV-2 infections. Not even that. These are PCR tests that detected fragments or whole live viruses, one of the two, in people. Case really ought to be reserved for somebody who presents to the medical system with symptoms that need treatment. That's a case. An infection is somebody who has the virus that's replicating. But you can still have a third class of people who are detectably carrying virus bits in them, either because they cleared the virus out so they are no longer infected or infective, all of that. So we don't really know what to make of this, but certainly it's awkward timing when you have so much of the world worrying about a second wave. I'm going to dispense with that in just a minute. I don't think we're seeing a second wave yet. We're hanging on to this XYZ theory. I'll tell you why. But look at the daily deaths over here. They're really not ticking up all that much compared to the cases. So it certainly looks scary. This is what the media is presenting all the time. Let's turn to the UK now as a case example of what we're dealing with in this story. This is what we're seeing. So this big, giant second wave, this huge, massive spike here. Let me get my drawing tool out. This thing here, look at that. Boom, just enormous. And so that speaks strongly to, yeah, that looks a lot like a second wave. Of course, these back here, these relatively few daily cases, infections, here's the hard part. Way back here in March and April, these were actually cases because very often the only people who were being tested were those who were presenting with symptoms requiring treatment at a hospital. So that way the infections and the cases were the same number, pretty much, back in March and April. But now we're trying to compare that to this big spike we see out here far to the right. And what is that spike right there? It's could be PCR tests that have been run to a 40 cycle threshold. So honestly, they are neither infective or possibly even infected at that stage. Could be false positives. Could be all kinds of things. Could be real cases. All that's mixed in. It's a little bit of a mess right now. And so one way we could detect this, though, is to look at the difference between, you might say, well, they're just testing a lot more now. So does that explain it? The answer there really is no. Skip too far ahead there. Because here is the daily number of case tests that they're running. Here, fairly linear increase, and then you see this explosion here. So this means the case or infection positivity rate is going up. And so this is arguing pretty strongly for a second wave, which means my XYZ hypothesis, which says that you achieve herd immunity pretty early on in this game if enough of your population gets exposed, but it's not 80 or 90% with seropositivity. It could happen as soon as 20% seropositivity because, for whatever reason, about half the people seem to be more or less immune. They're either asymptomatic or don't even seem to get it. Other people get really bad cases and they develop antibodies and all of that stuff. So X is the number of people who are pre-immune, if you will. Y are the number of people who develop a response to SARS-CoV-2, but they don't go down the antibody path. They develop some other immunity, probably T-cell immunity. And then Z are the number of people who actually develop the actual full-blown antibody response, which is what we detect when we go out and do these seroprevalence studies. Like how many people have antibodies circulating to COVID-19 or SARS-CoV-2, we should say. So this looks pretty bad. This is what the media is still reporting on. But as I said, apples to oranges, March to October. You can't really compare these two sets of numbers. So what might we look at? Well, I think you still have to kind of go with, because this is what the WHO is coming out with finally, is what really matters is this, because we're not going to beat the disease. China beat the disease. It looks like they have almost no cases showing up at all. New Zealand did, South Korea did, Singapore did. We're not in that boat here in the United States or in Europe. So you have to balance this out. 1, 2, 3. You got to try and keep the disease down. You got to keep your economy open. And you mostly want to make sure that your hospitals are not overwhelmed. So in this story, are we really interested in this here, which is cases, as they call them, or detected SARS-CoV-2 fragments of RNA? Is it the ratio between the number of tests that are performed and the number that come back positive? Is it the positivity rate? Is that what we care about? I would argue it's neither of those things. I would argue that what we really care about is we want to look at cases as compared to deaths. So here in the UK, we would notice something pretty interesting. The detected cases now, look at this horrifying second wave over here. It looks really bad. It's a 3x increase in detected positive SARS-CoV-2 tests, right? So from around from about 5,000 a day all the way up to about 15,000 positives, right? And they're calling them daily new cases. So if this was about to swamp number 3 in our story, it's about to swamp hospitals, it ought to be swamping hospitals. And what we see is that between the height of what was happening in March and now in the UK, there's about a 12x decrease in deaths. So I'm going to argue that this data still suggests that whatever we're seeing here on this chart, we can't really compare this part back here to this part way out here. Something's just different, right? I mean, if you would suspect if you had a 3x increase in so-called cases, that this ought to follow along, and it just hasn't yet so far. It might, but it hasn't. And we've had plenty of weeks to do this now. So normally there'd be about a 3-week gap between a case and somebody actually falling ill or dying and going to the hospital, stuff like that. So that's where this starts turning up in early September. So what's that? 6 weeks ago. Feels like plenty of time for deaths to have followed along. They have a little bit. You could make the other argument that deaths now are 3 times higher than they were just a few weeks ago, but they're still a pale shadow compared to what they were during that first wave. So how do we explain this then? If the XYZ hypothesis is going to hold, and I'm not here to defend it and tell you it has to be right, but what we would suspect there is that there is a set number of people who are going to need to be exposed in order to achieve herd immunity. We all agree with that. The question is, where's that number? And the argument here is that what lockdowns do is they put you, I put this in a number of weeks ago, is this idea, which is if you don't do anything in an epidemic, you don't do nothing, you just let it happen, right? You get this red sort of a curve here where you get this big giant increase in cases reported and it just burns itself right out. I think there's some countries that actually follow that curve very, very closely. There's another thing you might do, which is in blue here, where you're starting to get that case, cluster. You're in the boom stage and you shut everything down. You go into lockdowns, you crush your cases. But then you know what? There's burnout of people. People no longer can manage being isolated that long. They want to get back to their lives. They just can't stand having to wear masks anymore. They don't like the imposition. Whatever the story is, they grow weary, and which is totally understandable. And so then you get this second thing that would come out. That's what I'm arguing right here, the second pair of yellow lines I drew on the blue lines. That's what I think is happening in places like the UK, where they had a pretty strong first response to the first portion of the wave. Otherwise, what you might see is if you have social distancing, it just sort of flattens the curve, and you get this thing that comes through. I'm going to submit to you that that's what we're seeing in a lot of countries that were a little bit poorer, maybe didn't manage this quite as well. All right, so all of that said, second wave, where are we? Chris, are you worried about this? The answer is no. No, I'm actually not as worried anymore. I respect this. I don't fear it as much anymore. And the reason for that is because of data like this that's now beginning to pour in. This is one I just came across recently. Effects of ivermectin, azithromycin, cholecalciferol, vitamin D, a combo therapy. We're interested in this, aren't we? Vitamin D plus azithromycin plus ivermectin. And by the way, it doesn't have to be azithromycin. It could be doxycycline. But let's check this out. I like this a lot. So proof of concept study. This is all this is small, okay? But if you got this proof of concept for remdesivir, we'd be firing up a 50,000 patient study right away. Check this data out. It's carried out on confirmed COVID-19 patients. Check for that in Mexico City from April 1st to April 20th, 2020. Why am I rolling my eyes? Because April, May, June, July, August, September, October, November, October. That's 6 months ago. Half a year ago, we had this data. It should have come roaring out of this clinical trial into the rest of the world. Because check it out. Patients who met inclusion criteria were invited to take ivermectin. So they took 6 milligrams once daily on days 0. So that's the first day, 1, 7, and 8. Plus azithromycin, 500 milligrams daily for 4 days. Plus cholecalciferol, so that 4,000 IUs twice daily for 30 days, so 8,000 units a day. Just remember those numbers, good numbers. Treatment outcome was evaluated on the 10th day onward from the first day of the drug intake. Recovery rate of the 28, very small, 28 patients that received the combo therapy was 100%. It's a good number. And the mean symptomatic recovery duration was 3.6 days. That's awesome. That's really, really short. And negative PCR confirmed on day 10. So there are people out there who are just like spewing virus or have positive PCRs 10 days, 28 days later. It's astonishing. They even did imaging findings of patients with pneumonia were improved on day 10. And transient and mild degree of adverse effect like diarrhea and nausea was noted by 3 or 10.7% of the patients. This study found that combination treatment might mitigate disease progression without significant adverse effects. Indeed, it did. So small study, but 100% recovery there on the people. Okay, small study, not that impressed yet. Chris, what else you got? How about this one? I got to skip that one first. This one. This comes to us from India. Quadruple therapy with ivermectin, effective in treating COVID-19, they say. Really awesome stuff coming out of India here, elaborating on the effective methods being followed for treating COVID-19 across the globe. This specialist here, working at Monash Health in Melbourne, Australia. Remember Australia, we talked about a good doctor down there talking about combo therapy as well. Not this one, different guy. Has strongly advised what he termed quadruple therapy involving 4 medicines. Check this out. Ivermectin, Doxycycline, Zinc, vitamin D3 as preventative as well as a treating method, as a preventative too. So referring to a pre-official release of a randomized controlled trial. All right, we're getting there. Using ivermectin in 3 doses in primary contacts of COVID-19, said that 93% of primary contacts who received ivermectin did not develop any symptoms. 93%. And 58% of primary contacts who did not receive ivermectin did progress to have symptoms of the pandemic. So 7% compared to 58%. So only 7% did, 58% did ivermectin to no ivermectin. So this quadruple therapy, here you go. Here's some more numbers for you that you can add to the early ones I said. Includes ivermectin, 12 mgs, 1 dose. The other one we talked about was 6 mgs, 4 doses over 4 days. This is just a single shot, 12 mgs. Doxycycline instead of azithromycin, 100 mgs, once a day for 4 days. Zinc, 50 mgs, once a day for 4 days. And vitamin D3, once a week. I don't know how much vitamin D3 they're using here. Ivermectin, doxycycline, and zinc are to be repeated every 14 days, and vitamin D3 every week with blood levels monitored. Good point. I can't always tell people, I'm asked often, how much vitamin D3, and it kind of depends what your blood levels are. If they're really low, just crush it. Take massive quantities till you get it up. If you already have a fairly high level, you just want to give a maintenance dose. So you kind of need to get a baseline in your D3 if you want to answer the question, how much should you be taking as a supplement in this story? They note here the synergistic effect of these medicines act to prevent viral multiplication, also stop the virus from entering human cells. This is the other Australian doctor who talked about the triple combo therapy earlier, is Thomas Barodi, an Australian gastroenterologist. He was the peptic ulcer guy. And so he talked about triple antibiotic therapy. So he revealed that 1 block in South America that received ivermectin combination prophylaxis did not contract coronavirus infection while others did. So ivermectin, it's a preventative and a treatment. So this is pretty awesome. And by the way, in India now, they are using this quadruple therapy pretty broadly. So you'd think, we should probably see that in the results, right? So what kind of results? Well, I don't know, deaths per million. Maybe we could look at those results. So let's compare. The United States here, which does not use ivermectin and would frown upon it and make it difficult for you to get. Maybe, I don't know, some people, I can't advise this, but I know people who've gotten horse paste with ivermectin in it, or pet amounts if they can't get it from the doctor. Let's see here. Deaths per million. 664 deaths per million in the United States. India, with a massively larger population, slums, a healthcare system that can't possibly compare to the United States, then they're logging in at 80 deaths per million of population. I don't know. Is it the ivermectin? I don't know. But if it was me, I'd be asking India, hey, what are you guys up to over there? You guys and gals, what are you doing? We want some of that, right? And so I think you can see that pretty clearly in the data. The countries that have gotten their arms around using this seem to have a much better chance at things. So With all of that said, what's one other thing you can do to reduce your risk of COVID? Apparently it's have kids. So I don't know what to make of this. I'm just reporting on it. This I don't quite get, but sometimes this is where the most interesting things come from, when you get that piece of data that makes you go, I don't get this. But here it is. Sharing a household with children and risk of COVID-19, a study of over 300,000 adults living in healthcare worker households in Scotland. So the thing they were testing for here is, of course, two things. First, people who work in a healthcare setting are at much, much higher risk of contracting COVID. Two, kids, they're vectors, little disease vectors. You know, when a kid comes home from nursery school or first grade, usually I think their saliva is like half virus particles by weight. You know, I'm just kidding. But they're pretty good at transmitting stuff. So the thesis they had was these poor healthcare workers, not only are they getting bombed at work, but then they come home and they got kids. Maybe they're really extra at risk. So they went in looking to see a higher signal, I'll bet, and they found the opposite of that. It's really kind of cool. Excuse me. So the reason for the protection that kids are protected is not really well understood, but could be differences in immune response and stuff like that. Yeah. But if such differences are due to differential exposure to non-SARS-CoV-2 infectious agents, so maybe all these kids with their half by weight saliva particle virus system going on, maybe they've just got so many other virus attacks on them that this confers a beneficial effect for SARS-CoV-2. Could be. So adults who are close contacts with children may partly share in this protection then. That's an interesting theory. Such protective effect would have important implications for the lives of children, not least in terms of schooling. Wouldn't that be a cool thing if it turned out that not only do kids not get this, but if they came home, they would somehow be able to confer their protectiveness onto the adults they live with? That would be really cool. Is that the case? Well, it's kind of what they found here. So pretty interesting what they did here. They examined whether a household with young children aged 0 to 11, so that's the age range here, attenuated the risk of hospitalization with COVID-19 and or testing positive for COVID-19 infection of any severity. That's any case of COVID-19. So all healthcare workers directly employed by the NHS in Scotland or contracted to provide general practice services were included in this study. Outcomes were obtained via linkage to Scotland-wide microbiology, drug prescribing, hospitalization, and death data. All right, so they just boiled the ocean, looked at 300,000 people. Results, I love this. 241,266 adults did not share a household with young children. 41,198, 23,783, and 3,850 shared a household with 1, 2, or 3 or more young children, respectively. So tens of thousands of households to compare against each other. Boil the ocean. What'd you find? The risk of hospitalization with COVID-19 was lower in those with one child and lower still in those with 2 or more children, adjusting for age, the hazard ratio was 0.83 per child. So a 17% reduction in risk of either contracting COVID or being hospitalized. A 17% reduction in risk for every child you had. So they had a dose response here. Children, a dose response. I can't wait to see how this turns out, because this is where science happens, where somebody notices something and they go, and then they start unpacking it, and then we find something out in here. It's going to be very cool. I hope they follow this up good and hard, because this is really interesting. Anyway, they did a bunch of stuff. All I can tell you is I'm just like, what? I just don't get this at this point. I'm confused. But great stuff here, very interesting results. So congrats on running that study, and I'm intrigued by where it goes from here. All right, all that said, I'm not as worried anymore, because I think best in world treatment right now, especially if you have pre-exposure or early exposure, this is COVID. So the sooner you can get on this, the better. Best in world treatment right now for that early pre-exposure sort of time frame, to me, includes Ivermectin. It could be that 12 milligram one dose. It could be 6 milligrams for 4 separate doses over 4 days. I don't know, but it's Ivermectin at some dose level. It includes vitamin D. Again, dose depends on your starting condition, how much you have in your blood. Zinc, 50 mgs once a day for 4 days, and then that's going to be repeated on a 14-day cycle. As well, Doxycycline, just 100 mgs once a day, 4 days. Very simple. To me, that seems to the signal that we're getting out of this kind of treatment data now is astonishing. But again, don't do it late. I don't want to read one more study where they said, well, we had these people come in and we tried everything. We put them on ventilators and we're like, oh, well, and we gave them some Ivermectin, it didn't work, right? Or hydroxychloroquine, didn't work, or whatever they're trying. Don't do that. Do it early. Get it in there early. All right, I see I'm running a little late on my time here. By the way, let's just back up that who buzz one more time and make another who turn on the highway of information. Way to go, WHO. You've just confused everybody. Nobody knows what to think at this point in time. Lockdowns, yes, no. Masks, yes, no. Should we all be taking remdesivir? Yes, no. We don't know. What are the best treatments? None of that stuff. How come? Come on. Why is it that I'm sitting here with a Comcast connection, digging through the internet, finding this stuff out so many months in advance of organizations that got way more experience? It's their job. This isn't even my job. You know what my job is? I got to go feed cows after I get off of here. I got to make sure the chickens are, predator proofed. I got to build a run-in for the cows this winter. That's my other job, right? So at any rate, way to go, WHO. Let's just keep all that going. By the way, my main conclusion to everything is that it's time for everybody to become resilient. I have a lot of economic data, and there's a larger framework of what's actually happening. I think the economic damage off of this stuff is just going to be just profound. It's already happening, and the idea that the Federal Reserve and other central banks are printing money and making sure the stock market is well bid is actually adding fuel to a fire that's beginning to really burn. So if you want to know more about that and becoming resilient, I can't think of a better thing to do with your coming weekend, not this one, next one. Adam will tell you all about it in a second, to attend our Peak Prosperity Seminar. It's fabulous, got a ton of great guests, and we're going to be talking about economy, energy, environment, resilience, things like that. So come on and check that out. Adam, tell people more about that if you would.
Hi folks, Adam Taggart here, Chris's fellow co-founder of peakprosperity.com. I'm here to tell you that this year, due to COVID, we're bringing our annual seminar digital for the first time ever. And the theme is going to be, how do we prosper in a post-coronavirus era? We're going to be tackling questions like, how can we protect our loved ones and our wealth? And is there a way to prosper through the coming disruption that COVID's unleashing? Because of this crazy time, Chris and I wanted to do something truly special for our followers, which is why we're bringing together more expert speakers for this seminar than we ever have before, and we're making it all available to you at a truly rock-bottom price. We're going to have an amazing lineup of talent this year. We're going to have economic experts like Mike Maloney, former Fed advisor Danielle DiMartino Booth, technical analyst Sven Henrik, macro experts like Wolf Richter, John Rubino, Charles Hugh Smith. We're going to have energy experts like Richard Heinberg and Art Berman. We're going to have farming and environmental experts like Joel Salatin, America's Farmer, the folks at Singing Frog Farms, and many other experts in building resilience across your money, your health, your home, and your community. Now, the conference is going to take place the weekend of October 24th and 25th. It's going to be 2 days of packed presentations, panels, and live Q&A. But don't worry if you can't attend live or watch the entire live event. Everybody who registers is going to receive replay videos of all of the presentations, plus hours of additional bonus presentations that we just simply can't squeeze into a 2-day event, and trust me, we've tried. If you register now before September 30th, you're going to get all of this for the extremely low early bird price of $179. And if you happen to be a premium Peak Prosperity subscriber, you're going to get an additional 15% discount savings on top of that. To learn more, go visit peakprosperity.com/seminar2020. Chris and I hope to see you there in October.